Are you over 60 and waking up multiple times each night to use the bathroom? Do you find yourself struggling to start urinating or feeling like you can never fully empty your bladder? What if I told you that the real culprit behind your prostate problems isn't just aging, but 10 specific things you're probably doing every single day without realizing the damage they're causing? I'm a practicing physician, and in my 25 years of treating men's health issues, I've discovered that most prostate enlargement cases aren't inevitable, they're preventable. Today I'm going to reveal the 10 silent prostate destroyers that are quietly sabotaging your health, and the number one destroyer will shock you because almost every man over 60 does it daily. By the end of this video, you'll have the knowledge to stop prostate growth naturally and reclaim your nights of uninterrupted sleep. The seventh silent destroyer is something almost every senior does, taking multiple medications without considering their combined effect on prostate health. Many common medications, including antihistamines, decongestants, antidepressants, and blood pressure medications, can affect your ability to urinate properly. When you're taking several of these medications together, their effects compound, making it harder for your bladder to empty completely and putting extra strain on your prostate. Always review your medications with your doctor and ask specifically about their impact on urinary function. Sometimes a simple adjustment or timing change can make a huge difference in your prostate symptoms. Number 6 is eating your largest meal late in the evening. When you consume a big dinner close to bedtime, your body is still working hard to digest food while you're trying to sleep. This digestive process increases inflammation throughout your body and can worsen prostate swelling. Additionally, late meals often lead to increased fluid intake close to bedtime, which means more nighttime bathroom trips and more pressure on an already sensitive prostate. Try to finish eating at least 3 hours before bed and make your evening meal your smallest of the day. This gives your body time to process everything before you lie down, reducing overnight inflammation and pressure on your prostate. The fifth destroyer is something that seems harmless, using your smartphone or tablet while on the toilet. I know this has become incredibly common, but it's actually harmful to your prostate health. When you're distracted by a screen, you're not paying attention to your body's signals, and you often end up straining unnecessarily or not fully emptying your bladder. This incomplete emptying leaves residual urine that can irritate the prostate and increase infection risk. Additionally, the longer you sit on the toilet while distracted, the more pressure you're putting on your pelvic floor muscles and prostate. Make bathroom visits quick and focused without digital distractions. Number 4 is sleeping on your stomach. This sleeping position puts direct pressure on your lower abdomen and compresses the area around your prostate and bladder. Throughout the night, this constant pressure can restrict blood flow and increase inflammation in your pelvic region. Stomach sleeping also makes it harder for your bladder to empty completely during nighttime bathroom visits, because the position doesn't allow for optimal urine flow. If you're a lifelong stomach sleeper, try transitioning to sleeping on your side with a pillow between your knees, or on your back with a pillow under your knees for support. This change alone has helped many of my patients reduce their nighttime urgency. The third silent destroyer is something that affects millions of men but is rarely discussed: chronic constipation. When you're regularly constipated, the accumulated waste in your colon puts direct pressure on your prostate gland. The prostate and rectum are neighbors in your pelvis, and when one is under pressure, the other feels it too. Chronic constipation also increases overall inflammation in your pelvic region and can lead to straining during bowel movements, which puts even more pressure on the prostate. Focus on getting adequate fiber, staying hydrated, and moving regularly to keep your digestive system flowing smoothly. Your prostate health is directly connected to your digestive health. The second destroyer is particularly relevant for retired men, losing your sense of purpose and social connection. I know this doesn't sound medical, but research consistently shows that men who feel isolated, bored, or without purpose have higher levels of chronic inflammation throughout their bodies, including in the prostate. Depression and loneliness trigger stress hormones that directly contribute to prostate enlargement. Men who stay socially engaged, pursue hobbies, volunteer, or maintain regular social interactions have significantly better prostate health outcomes. Your mental and emotional well-being isn't separate from your physical health, they're intimately connected. Make social connection and meaningful activity a priority, not just for happiness, but for your prostate. Now, the number one silent prostate destroyer, and honestly this is the most important thing I'll tell you today: ignoring the subtle early warning signs and convincing yourself that frequent urination, a weak stream, or those nighttime bathroom trips are just normal aging. This mindset is really the most dangerous because it prevents you from taking action when interventions are most effective. Every single day you tell yourself this is just getting older is another day of potential damage to your prostate. The earlier you address prostate issues, the more options you have and the better your outcomes will be. Those so-called minor symptoms are actually your body's way of asking for help. So, listen to them, track them, and take them seriously. Speaking of tracking, this brings me to something that could, really change your life. The Senior Health Tracker app that's specifically designed for men over 60 dealing with prostate concerns. This isn't just another health app, it's actually been created by doctors who understand exactly what information you need to monitor and what your doctor needs to see to help you effectively. The app tracks your urination patterns, fluid intake, sleep quality, and symptom severity, then generates reports you can share with your healthcare provider. What makes this special is that it's designed specifically for our age group and our particular health concerns. You can download it free from the link in the description, and honestly, I encourage you to start using it today because the data you collect over the next few weeks could be invaluable for your health decisions. Here's what I really want you to understand. Your prostate health is largely in your control. While genetics and aging do play a role, the daily choices you make have an enormous impact on whether your prostate stays healthy or becomes a source of constant discomfort. The 10 destroyers I've shared today aren't just theories. They're based on decades of clinical experience and research with thousands of men just like you. Start with the easiest changes first. Maybe it's loosening your belt, spacing out your water intake, or putting your phone down in the bathroom. Small changes create momentum for bigger ones. Remember, you don't have to accept prostate problems as inevitable. You have more power than you think to influence your health outcomes. The most important thing you can do right now is start paying attention. Notice your patterns, track your symptoms, and don't dismiss changes as just aging. Your body is constantly communicating with you. The question is whether you're listening. Use the tracking app I mentioned, make one or two of the changes we discussed, and give your body a few weeks to respond. You might be amazed at how much better you feel. If this information has been helpful, please share this video with other men in your life who might benefit. Prostate health isn't something men talk about easily, but it should be. The more we share knowledge and support each other, the better outcomes we'll all have. And remember, it's never too late to start taking better care of yourself. Your prostate, your sleep, and your quality of life can all improve with the right approach and consistent effort. Take action today, because tomorrow's comfort starts with today's choices.